In this question, we have a 25-year-old man with a gunshot wound to the abdomen 45 minutes ago. 1 liter of normal saline was given for hypertension. His blood pressure is 97/60, pulse is 130, respiration is 22. He's moving all of his extremities, but they're cool and clammy. Ultrasound shows free fluid in the abdomen. Question asks, continuation of additional normal saline fluid boluses in this patient would most likely result in which of the following? Now, this patient is in hemorrhagic shock due to the gunshot, and his blood pressure is 97/60, and so he's hypertensive as well as tachycardic. Now imagine that this is a blood vessel for this person, and inside this blood vessel we have blood, and inside the blood we have blood products like platelets and coagulation factors. Now the question is asking if we continue to give this person normal saline, then this would most likely result in what? So if we give this person more normal saline, then we're essentially going to increase the volume. And so if we increase the volume, and normal saline is a crystalloid fluid that contains only electrolytes and small molecules, so it's not going to contain any of these platelets or coagulation factors. So if we increase the volume, then we're going to be diluting these coagulation factors. As a result, we're going to put this patient at a higher risk for coagulopathy or impairment of coagulation due to this dilution of platelets as well as coagulation factors due to the increase in volume from the normal saline, and normal saline only contains electrolytes and small molecules. So as a result, it's going to cause impaired coagulation. Now, if we overuse crystalloids like normal saline, then we need to keep in mind the lethal triad. Now, the mnemonic that I made to remember this is CIA is a lethal agency. So the C is for cold or hypothermia. So the fluid that we're going to give is going to be colder than body temperature. As a result, this can cause hypothermia. The I is for impaired coagulation. So we just discussed, due to the dilution, this is going to impair coagulation. And the A is for acidosis. So normal saline contains an even distribution of sodium and chloride can acidify the body, and so that can cause acidosis. Now, because normal saline does not contain bicarbonate, then there's not going to be a buffering agent for this chloride. As a result, we can get acidosis. So this is the lethal triad to remember for crystalloids. So hopefully this mnemonic helps.